What did this broken queuing system we call Canada's healthcare system achieve together? Let me give you an incomplete list. We procured massive quantities of supplies and distributed them across the country. Personal protective equipment, swabs, hand sanitizer, ventilators. We massively ramped up testing capacity. We stood up assessment centers, drive-through clinics, mobile outreach teams to go into shelters, long-term care, and congregate living facilities. We trained and retrained healthcare workers to do new forms of care. We instituted billing codes and protocols for COVID at home clinics and virtual care for people with acute and chronic medical problems. We opened field hospitals and tents in parking lots. We participated in clinical trials to determine which drugs to use and at what doses. We collected data about who was most impacted by the virus. Data, lots of it made transparently available, and we allocated resources accordingly when they were scarce, like testing, drugs, and vaccines. We moved patients out of hospitals that were overwhelmed, whether that meant from Scarborough to University Avenue or from Saskatchewan to Ontario. We sent teams of workers into long-term care facilities to try to stem the impact of decades of poor design, understaffing, profiteering, and under-resourcing on our elders. And we stood up one of the world's most successful vaccination campaigns, learning from early design mistakes and adopting community-based strategies that were unprecedented at that scale. For those of us at the front lines of leadership and care delivery, this meant getting up every single day for months on end and inventing new ways to do our jobs. The result was a world-class pandemic response, and the common thread was collaboration. It was coordination. Resolving actually for once to eliminate competition, of which we have tons actually in Canadian healthcare. So let's be real, we have a long road of recovery ahead. It's going to be really hard. Service backlogs, human resources shortages, mental health impacts. The coordinated effort required will probably dwarf what we have just achieved. But we are charged here tonight with saving Canada's healthcare system. When my family member or yours starts hearing voices that aren't really there, when one of us steps out into the snowy street tonight and gets hit by a drunk driver, when our aging parents leave the stove on by accident, it's not competition that will save us. Only collaboration can bring us hope. I want to talk about Europe, because we've heard a lot about Europe and we all like to go there, and I want to remind us that we share the largest undefended border in the world, not with France, sadly, for all of us who love pastry, and not with Finland, but with the most profit-driven health system in the world, and the one that, as we have already heard, produces the very worst outcomes on virtually every international sphere. In England right now, the nurses are on strike for the first time in the history of the NHS. In France, on strike. Macron has declared that he'll be completely overhauling the French healthcare system. In the Netherlands, on strike, national hospital workers across the whole country on strike in 2019 over shortages of labor, over working conditions and wages. Spain, all the workers on strike. Germany, strike. Turkey, strike. You want to know why? Global pandemic. Global human resources shortages. It's a big myth that we don't have competition in Canadian healthcare. Actually, we have tons of competition in Canadian healthcare. On the payment side, as we've heard, around drugs, long-term care, home care, physio, dental, all of the things that you pay for through your private insurance and out of pocket, that's competition of payer. And on the delivery side, tons of competition among providers, and in fact, as we've heard, a complete absence of collaboration. And so I think that this notion that we don't have competition, or this characterization that everything is a government monopoly, is actually, it's false. We have more competition, in fact, than is healthy for us when you think about the aging of the population, the rise of chronic disease, and the complexity of the services that we need to provide, the need for information flow and collaboration to happen across silos. We need online booking. We need transparency of information. We need coordination. We need to axe the facts. Like, none of that has anything to do with competition. In fact, as we all know, in a competitive environment, the incentive is for people to hoard their referral base. Indeed, what we see currently, I'm a family doctor. I was in clinic until 8:30 last night. Do you know what it's like to be on the sending end of that fax? It is not fun. I have no idea how long any given surgeon's wait time is for a problem. And when I send it to them, they could be 6 months, it could be 6 days. You could have a new grad that I've never heard of. I don't know where to send that information. I'd like to point to an example in British Columbia, actually, of competition, a form of competition that I think is upending the public system, and that is the First Nations Health Authority of BC, a completely independent, self-governing, Indigenous-led model of care for the Indigenous people of British Columbia that is having a superb impact on health outcomes. Why? Because it's community-governed, it's community-owned, it's built by the people who know their communities well, and it includes Indigenous ways of knowing. It includes Indigenous approaches to how we think about healthcare and medicine, and it's totally separate from the rest of the BC health system. So if we're including in that, in our definition of competition, community-governed and community-led models that come from the ground up, that are owned by people who know how to build the services that their own communities can trust, I'm all for it. There's a form of competition I'd be down for. We're not actually changing Canadian healthcare here tonight. I know you're all shocked to discover this is just a pretend exercise. It's a debate, and they had to convince you of two things. The first is that the system is broken, and the second is that competition is what will fix it. In fact, the word is save it. And I think, there's an interesting list that Sean has just provided to us of a whole bunch of stuff that, look, dude, we've been doing activity-based funding in Ontario hospitals for decades. Where have you been? A lot of this stuff is already going on, actually, and none of it relates to competition. I'm going to take just a minute on math, because I can't help myself. It is not true that Canada has among the most expensive health systems in the developed world, as long as what we are talking about is public payment. So in Canada, we have an expensive health system by international standards, third or fourth among developed countries, for total spending, including public and private. That includes all the private expenditure on pharmaceuticals, on physiotherapy, on vision, on dental, on long-term care, on home care, all of that spending. If you look at what we spend publicly, we immediately fall close to the bottom of the list. We are 9th out of 12.